Hi, my name is Jessica Presperin Pedersen, and Emma Friesen is also an engineer that works with me, and we wanted to share our protocol for some research we're planning on completing. This is generating evidence for a mobile shower commode chair, and it's a study protocol. Emma Friesen is an engineer. She works full-time for RAS Design, and I'm a consultant for RAS Design, and RAS Design is presenting this research. The aims of this study and the reason why we're doing this is because RAS advertises that pressure changes when different aspects of the shower chair are put into optimal positions, and we wanted to make sure that we had evidence to prove that. And so first we're going to test the efficacy of the adjustable devices on it so that it will increase pressure distribution, provide postural support, and enhance function. And then we wanted to identify validated and feasible outcome measurements that capture these objectives of effectiveness and then show clinical evidence for any kind of stakeholders, so users, clinicians, suppliers, funders, and policymakers. We have several hypotheses, as you can see. The first is that we wanted to show that pressure mapping scores with underneath the ischial tuberosities will be decreased with tilt. Then we wanted to show that the footrests have to be in the right place. And so we're going to adjust them to what we feel is the optimal position and then raise them 2 or 3 inches and show the differences in those pressure mapping scores. And then a lot of individuals with spinal cord injury are using this shower chair to reach underneath the cushion for digital stimulation. And so we wanted to demonstrate the difference between having a cutout on the side, which requires less reach and less bending, to not having a cutout on the side. And we'll take pressure mapping of that. And then also we're looking at functional abilities for completing bowel and bladder routine, and we'd be working with the individuals to talk about that and getting some personal input. The methodology required 90 participants, and we were going to be using the standard RAS seat and then the visco foam interface seat and show the differences between that and then what we just talked about with the hypothesis. And so we'll be using pressure mapping, we'll be using a usability access, and then we'd be also asking about pain. So did pain change when we changed positions? So our methodology will begin with MSCC being upright, and the client will be positioned in an upright position, and then we'll adjust the footrest and the armrest and the seat position. The seat has what we call an I-pass that goes underneath the ischial tuberosities to clear them. Then we're going to tilt the MSCC 20 degrees and take that pressure map, 40 degrees and take that pressure map, and we'll adjust the blocks if we can't adjust the footrest to be 3 inches higher. Then we're going to take the footrest and flip them and leave the feet unsupported to simulate the footrest being too low or non-supported at all. Then what we're going to do is have the individual reach underneath the seat to simulate digital stimulation and press upwards to simulate that so that we can actually assess what the pressure is in those positions. Emma Friesen, who was working with me on this grant, developed an assessment tool that looks at user rated usability when they're using the shower chair, and we're going to be using that to be able to ask questions. And then lastly, we're going to use the numerical pain rating scale before the intervention begins and afterwards to find out if there's any decrease in pain at all. The changes that we've made because of this, and this is not going to be on the assessment of this poster, is that because of COVID, we're not using individuals with disabilities in hospitals because we can't get into those sites. Where I work at the Shirley Ryan Ability Lab, it's a conflict of interest for me to do the testing there because the Shirley Ryan Ability Lab purchases these systems for their inpatient use, and then they recommend for outpatients and people that are leaving the facility. So we've changed our protocol a little bit, and now we're going to be working with 90 individuals who go to Governor State University, they're physical therapists, occupational therapists, and then students that have disabilities that attend that school. So now we're not doing usability because our students may not have disabilities, and we're not using the pain scale. So it's strictly pressure mapping. But please understand when you do this before and after assessment for the poster that you look at what we were going to do originally, because this was developed before COVID hit. Thank you very much.